Good afternoon, all my dear students. I am Sandeep Mukati from Modern Institute of Pharmaceutical Sciences, Indore. Today we are discussing about dispensing of controlled drugs. What is controlled drugs or controlled substance? Drugs whose sales, possessions, and use are restricted because of the effect of the drugs and the potential for abuse. Includes illegal drugs and prescription medication. Dispensing of controlled drugs. Controlled substance is a drug or chemical which ownership, manufacture, or use is the absolutely regulated by a respective government of country such as illegally used drugs or prescription medication. These laws enforcement leads to prevention in the unauthorized use of such medications. These laws enforcement leads to prevention of the unauthorized use of such substances or drugs such as central analgesics, anesthetics, steroids, etc. These controlled substances are listed following schedules. Schedules Schedule first, Schedule second, and Schedule third. Schedule first. The drugs under this schedule have high potential for abuse and have no accepted medical use in the treatment. Example raw opium. Schedule second. The drugs under this schedule have less as compared to above potentials for abuse accepted for medical treatment and have less physical dependence and physiological dependence. Example benzodiazepine and painkiller and steroids etc. Schedule third. The drugs under this schedule have less as compared to above potential for abuse accepted for medical treatment and have less physical dependence and physiological dependence. Example phenobarbital, low strength codeine, etc. Hospital controlled procedure. Following procedure and person or department is responsible for manufacturing and record of controlled substances in hospital. First, pharmacist in chief, second, head nurse, and third, administration head. First, pharmacist in chief, responsible for the purchase, storage, accountability, and appropriate dispensing of the controlled substance in the hospital. And second, head nurse, responsible for the record of proper storage. Third, administration head, responsible for the proper safeguarding and handling of controlled substances. Policies and procedure for ordering of controlled substances. First, preparation of orders. Second, doctor orders for administration of controlled drugs. And third, PRN or first preparation orders. Order of the controlled substances should be made by using ink or inkable pencil, typing and duly signed by the respective doctor. Second, doctor's orders for administration of controlled drugs. Orders of controlled substances for ward stock must on physician order sheet or patient chart. If the controlled substances for ward stock must write a physician order sheet or patient chart. If the controlled substances are not in ward stock. And last, PRN order. These types of order must be discouraged except under special circumstances. Next, verbal orders. In emergency cases, a doctor may give a verbal order of controlled substances and the nurses may write such order sheet and later duly signed by doctor within 24 hours. ordering non-ward stock controlled drugs from pharmacy, ordering of the controlled substance for non-ward stock done by doctor sign, and if more substances are again needed, the doctor may be sign again. Ordering ward stock controlled substances from pharmacy. Ordering of the controlled substances from pharmacy must be taken on the ward stock from which is completed by placing a check mark on the opposite the name and strength. These order from must be duly signed by the doctor. Procedure for dispensing of controlled substance for inpatient. Doctor order for administration. Ordering of ward stock from pharmacy. Narcotic and controlled drugs on ward by nurse. And charges for narcotics to the patient. Next, prescribing of controlled drug in outpatient department OPD. Dispensing of the controlled drugs from outpatient from pharmacy must be the made on the prescription only by clearing mentioning the strength and the quantity with duty sign of doctor. The information for such order includes first date, second details of patient, third patient hospital number, fourth amount of drug order, fifth strength, and sixth name of the prescriber and their signature. Next, dispensing of controlled drugs for house use when pharmacy is closed. When the patients are discharged from hospital or emergency ward at the time of close of pharmacy. Occasionally, such patients require drugs for use at home, and such cases dispensing of drug can be done by only on prescription, which must be signed by the staff who is a registered medical practitioner and also authorized to prescribe controlled substance for this purpose. Thank you all my dear student.